This is part of a kind of learning process that we've been through in trying to integrate the ideas around human-centered design and to learn about its value in our organization. So I'll let Lauren start.
Great. And so I trust that I'll let you in Connecticut know when to advance slides, if that's okay. Good morning, everyone, or afternoon, I guess now it is. I'm Lauren, and the slide that's on the screen will give you a little bit of an outline of what we're going to be doing. You may have heard the term human-centered design, you may have heard the term user-centered design, user interaction, etc. I just wanted to put a call out to the room. How many people are familiar with these terms? Have ever heard the terms human-centered design, user-centered design? And on the phone, yeah, I'm just looking at making sure to keep an eye on Connecticut as well. How many have done any kind of work? Have you either participated in a workshop or maybe have actually used human-centered design in your work? All right, good to know where we're starting. All right, so because there are lots of terms bandied about, I do want to be a little bit clear about what we're going to be talking about today. So for the purposes of this presentation, I am emphasizing human-centered design. And the reason I do so is that human-centered design sort of is an overarching framework of processes, practices that allow us to really hone in on what it is that our end user wants. What is it that the people for whom we are designing these programs make sure that we cover their wants, their needs, their contexts, their issues. JSI focuses on human-centered design because we're not necessarily just looking at a product. We're not always trying to create a mobile application or a toolkit, but we also use human-centered design as a launch pad, as the starting point for policies, sometimes for programs, sometimes for service design. So we can think about human-centered design as humans are the recipients of all of those things, and this is a way for us to reach them. So I'm going to move on to the next slide. So this is the next bit that I will be talking about, just sort of going into why design thinking, the rationale for human-centered design, and we'll do a really quick exercise. Next slide again. So this slide kind of says it all. We want to design with users, not for them, right? Because human-centered design is a creative process. It's an iterative process. It's a problem-solving process. It demands that we are open-minded. It demands that we are patient, because we have to start by investing that time to understand the people for whom we are creating a program. And we need to define our challenges from their unique perspectives. So by listening and creating, iterating with them, refining the process, we can come up with new, iterative, and groundbreaking solutions. And the goal is to create programs and services that meet their needs. And this enhances the effectiveness of interventions, make sure that they're tailored to our end user, and in turn is more likely to lead to sustained behavior change or effective impact and effect. One more slide, please. All right, so you may have heard of the concept of the squiggle. This is sort of used to illustrate the design process, sort of building out from the divergent process of coming up with lots of ideas, dispelling with some of our notions of what can't happen or what shouldn't happen, and then converging on a sort of unified idea that is user-informed, and then executing that idea, which we have to do in our programs. The reason I like this particular version of the squiggle is because it shows how iterative this process is. So it's not that the first idea that you come up with is going to be your last idea. Rather, you're going to be working and continually revising and building on the initial ideas that you come up with, to using user input to make sure that they are ultimately user informed and are going to be better received by the people you're creating for. So I want to take a second there and pause and just ask people in both places, if you have any questions, and what have you heard? What do you know about human-centered design?
I don't know much, but I've got many opinions, as some people know. And to me, just hearing the keywords you're giving sounds to me like we're trying to use a new concept, human-centered design, which is probably not that new, but in our field is newer, to kind of go back to basically good design. It's basically, to me, that's what I suspect. That's my preconception, let's put it this way.
Great. Yeah.
I mean, I think part of it is a move away from kind of abstract systems that look, that are strictly paper-based, but, solutions and design that, incorporates like human strength, but also human weaknesses, fallibility and all that.
Great. All right.
I'll just remark that I've been a fan of IDEO and learning about human-centered design through IDEO and the projects that they've done through that and their toolkit, which has helped me understand it better, which is really interesting.
Excellent. That's great to know. Anyone else before I move on? All right. So I'm going to get into a really quick design exercise. We have a small group today, and if we had hours and hours, we'd walk all the way through a design process on a specific challenge. But what I'd like to focus on is really the very first piece of a design process, and that's sort of empathy building and working on sort of understanding what we don't know about what we don't know about our end user. So if we could switch into the next slide. So meet Joe. Joe doesn't have much of a face. It's kind of ambiguous a little bit intentionally because we don't know a lot about Joe. What we do know is that Joe is starting a new job and Joe needs a new wardrobe. And our challenge is, how might we design a wardrobe that Joe will actually wear and that he will enjoy wearing to his new job? This is a very simplified exercise, but what I'd like you to do is spend, a minute tops brainstorming all of the things that you might think you need to know about Joe in order to create a wardrobe for him. And while you're doing that, also keep in mind, how would you find this information out? So I'm going to time myself and say, go ahead and get started. And stop. So, I don't know Joe, right? But I could make an assumption that based on very limited information that maybe Joe's favorite color is orange, that he might need some wool suits, he's a size medium, and he prefers to wear blue ties. But that information is just based on very limited information, and it could be completely off the mark. And I could spend a lot of money and time building a wardrobe for Joe that is based on not enough information. So I want to ask you guys, what do you think you need to know about Joe?
First off, what his job is. Different jobs at different formality levels. If he's in construction, he would wear something very different than if he has an office job.
Yeah. Anything else?
What his budget might be.
Mm-hmm.
I was thinking about what might be available to him in terms of like a market price, and what others are doing around him. Like what do his coworkers wear, and what do his friends and social network wear.
And how would you find that out?
I have no idea.
All right.
I don't know.
You can ask Joe.
Yeah, ask Joe or his social network, I guess, if you know his social network.
Others?
Well, you might want to know about a little bit about his personality, his comfort level. I mean, once you know the culture of a place, what's the norm, what's the standard, people like to blend in, people like to stand out. You know, so if everybody wears a blue tie, maybe Joe wants a red tie, or maybe he's the kind to not want a red tie because everybody wears a blue tie or something.
Right. Would we need to know what size Joe is? Or where does Joe keep his clothes? Like, where would he store them? How would he prepare them? Does he have an iron? Does he have access to an iron? Does his wife take care of his clothes? Does he have a wife? Like, how would they wash them? What does he have, what does he have access to? Where does Joe live? What does Joe have to do in the clothing? You made an excellent point, like if he's doing construction, that makes a very different point than if he's going to an office. If he has to bend over all day, maybe he doesn't want to have something that's particularly constricting. So there are a lot of ways that we could do this. And then I heard us say how we might talk to Joe. What other things could we do to find out about Joe?
Visit where Joe lives.
Mm-hmm.
Talk to people who Joe works with, or like just, get to know like what other people are wearing at work.
Great.
Get him to try some stuff,
Yep.
if you like.
Exactly. So I want to be mindful of our time here. This is a really oversimplified exercise, right? And we're not going to be designing wardrobes so much as we're designing programs for children, for adolescents, for mothers, and pregnant women, for men. But what I wanted to hit home was this idea of desirability. So clothing is a very personal choice, and then the need that you have for that clothing adds on to that, and the context in which you would wear that clothing adds on to that. So the desirability for Joe is he not only needs something that he's going to like wearing, he needs something that will work for what he needs to use it for. It's going to be easy for him to take care of, that it's not going to be, that he has a place to store it, that he has a way to buy it, that there are a lot of factors that go into thinking about a wardrobe for Joe. And so if we bought Joe new clothes without talking to him, without looking in his closet, without measuring him, without observing and seeing what his friends wear, what his colleagues will wear, we could maybe get some details right, but we could miss the mark on a whole bunch of others. We may spend a bunch of money buying clothes and creating clothes that Joe just won't wear because it doesn't work for him. And so by thinking about those questions that we need to ask Joe, that we need to find out about Joe, we would then maybe do some interviews, go visit Joe's home, look in his closet, talk to his friends, talk to his wife, see what Joe's budget is, see how Joe takes care of how Joe would manage his clothes. And we would be able to get a better understanding of what's desirable for him, which would in fact inform the rest of our design process. So I'm going to jump ahead another slide or two. So keeping in mind our little exercise with Joe, I want to segue into how we use human-centered design at JSI. So next slide again. Development adds a lot of complexity to the design process. So the process is almost in a lot of ways a little less linear than that squiggle that we were looking at before. We're getting buy-in from donors, from government, from ministries, from community members. We're trying to manage complex budgets. We're trying to plan in advance how we're going to answer that so what question at the end of the project. How did design make a difference? And we've been looking a lot at how we can make a policy or service or a program or a product better. But in order to do that, while we're trying to get to this sort of sweet spot in the middle that is desirable and feasible and financially viable, potentially sustainable, we need to start that first piece. What's desirable? What is it that our end users want? Because if we don't get that piece right, the others aren't going to fall into place either, and then we can wind up creating something that people won't use because it doesn't fit them. So hit up the next slide. So I'm going to give you a couple of quick examples, and then I'm going to hand the baton over to Anne, and she's going to talk you through some case studies. So the first one, our challenge in Ghana was, how might we improve community health nurses and supervisor job satisfaction and motivation? And we used design as a way of really understanding some of the motivation, some of the feelings, some of the challenges, stumbling blocks that these community health nurses felt in terms of their work. This led to the creation of an application, and this is going to be a lot of what Anne is going to talk about in a couple minutes. In Tanzania, our challenge was, how might we use human-centered design to bridge the gap between policy making and implementation? So in this case, we had, you think about how a policy is formed and all the different people who should probably have an input into it. So not just the policy makers, but the program managers, and ultimately the people who will be affected by the policy. But a lot of times, those people, that end user, are the people that are left out. And so we worked in Tanzania to incorporate design into the policy shaping process. And we did some design workshops, interviews with different stakeholders to really draw out key themes about what was desirable for the community health workers in designing a new community health worker policy in one of the districts in Tanzania. In South Africa, our challenge was, how might we use human-centered design to address the human factors that limit data use for decision making? So we've heard a lot about creating maybe different data dashboards and platforms, ways to deliver the data that we collect in public health and international development programs in a very accessible way. But one of the things that's often left out of that process is the humans who will have to use them. So how will these people be interacting with this dashboard and then using the information that they draw out of that to apply it in their work to make changes accordingly? And a lot of the times what happens is that we forget to think about that human piece, right, when we're creating a dashboard. And so in South Africa, we were looking at how could we use human-centered design to address the human factors that limit data use. And so we did a bunch of design workshops, prototyping different solutions that could be tested, revised, adopted. And this design process allowed us to engage different stakeholders to creatively facilitate approaches, understanding how people use data, how they understand it, and emphasizing the challenges that they face when they do so, so that we could ultimately brainstorm and design some tangible solutions. So next slide, and with that I'm going to hand over the baton to Anne.
Thanks, Lauren. Let's see your papers.
All right.
Okay, so let's pause a minute here and say, so what do you think about human-centered design? Does it ring true to you in any way? Does it reflect the kind of work that you've been doing? Is it different? What's it like? What are your impressions from what you've learned?
I think it would make sense if we design a program for people and they are not involved in the designing process.
So involving people. Yeah. Yeah.
I mean, it sounds like, we'll see when you get to your case studies, it sounds as if it works, it may be more suited for sort of smaller, to handle sort of certain problems, as opposed to very large programs where the donor's already kind of presenting you with a design to begin with.
Right. That's a good point.
But to me, it gets at some of the chronic issues we face. I mean, I've been in vacation, so reading some stuff I put aside, and I went back to that old book, you probably know Judith Justice on policy plans and people.
Mm-hmm.
And that's very much the same debate, right? I mean, what if you design something and the users are not in there, you know, how do you make all this happen? So to me it rings like, okay, you know, it's not a new revelation, but it's like we're still struggling to do that.
Struggling to get there, yeah. I mean, I know when we were first introduced to it as kind of the research partners for this innovations project, we were kind of cynical. We said, isn't that what we do anyway in public health? Don't we put humans anyway at the center of what we do? Of course, we're not designing for some abstract people. It's all about creating something new for human beings, better health. We've all been trained in participatory methods, right? Is this not just more about participation? So we came into it with a very questioning, kind of skeptical eye. And that was part of what kind of prompted us to promote this idea of using the experiences that Concern was having as case studies to say the field of public health needs a bit more grounding in what does this really mean to us, right? So case studies are a good way to try and unpack complexity and see things in context. And we use this case study approach to try and study the use of design in these 4 different settings. When we started out trying to develop a methodology for the case studies, we went to the literature to say, well, what do we already know about the effectiveness of design? What kind of metrics do designers use to understand whether their work is being successful? And the only thing we could find is when design has actually been used, and that's kind of where it's come from, is for product design. You know, a new piece of equipment or a new iPhone or something, and if sales shoot up, well, the design process has been very effective. But here we're talking about something a little bit different. And we couldn't find any kind of standard metrics. If you ask designers, well, how do you know that design has worked? They'll say, well, if you were there, you would have seen it. It's just like magic. Right? And as researchers and evaluators, we were like, well, don't buy that, sorry. We have to come up with some constructs that help us understand what is that pathway between the use of design and hopefully some kind of public health outcome, and what happens along the way and what role does design play. So we had to come up with our own kind of constructs to shape these case studies. So next slide, please. So we knew that the big fundamental issue about design is that it creates this opportunity for greater empathy between the designers and the end users, and that empathy is this driver of trying to develop something that is desirable and that people will take up and use. And we said, well, so what? So pick up and use. What happens in that process? What's actually happening there? And we came up with this concept of like, it's this idea of fit, right? It's that what we're proposing to introduce into your life actually fits with something that would be meaningful to you and that you will also agree is meaningful, and you will decide to do it, to use it, to change your behavior, to change your attitudes. So design is like a process that helps make us better fitters, people that make things fit together. And that's, you know, we always have that intention when we do program design. We don't want to create something that's going on over there and have all of our clients running the opposite direction. But sometimes, as we know, it doesn't work, and sometimes it doesn't work very fast. So we wanted to ask the question, well, could design be a tool that could be used to increase the pace, the likelihood of success and the pace of uptake or success? So we introduced that kind of research construct. And then we thought, well, clearly in the sense of what we want to do, which is longer term change of behavior, we brought in the concepts that we use all the time of people actually bought into this idea, and do they feel some kind of ownership over it? Meaning, like, you know, I sleep with my iPhone under my pillow. I own that iPhone, and if you took it away from me, I would be really mad. So this idea of is the behavior change actually inculcated in society? Are we creating those normative values where people will actually take this new idea and make it their own? And ultimately, yes, we want to know if it contributes to public health outcomes, but that pathway is a long one, right? So these were the kinds of constructs we set up for ourselves in trying to go and ask questions and in this case study. So next slide. So our key questions really that we used to shape our case studies was, first of all, let's just describe how design was applied. And people need to know how it takes place. And, you know, people often ask, how long does the workshop take, that kind of thing. Then we said, well, what came out of design and how did it get translated into an adaptation, a new kind of intervention? Because, in fact, for all of these 4 interventions, We didn't start from scratch. Can you go back one more? We didn't start from scratch completely. Nope, other way. We came with 4 kind of ideas, and we had to apply design to try and help make the design of the intervention more human-centered. And then our last question was basically those research constructs. Did design influence, did it bring about empathy, greater fit, uptake, buy-in, and ownership? Was there an influence on the pace of ownership? And could we actually draw a link between that and the outcomes? So we did this for 4 different projects. 2 of them were community-based public health interventions. One was actually a collaboration between engineers in the School of Engineering in Nairobi and the hospital to look at hospital equipment that was being used in the neonatal ward to see if they could design things that were locally more relevant and sourced. And the other one was about transforming public health, traditional birth attendants into public health health promoters. So there were 4 different ways that places that design was used, and 4 different kind of doses of design that took place. In a couple of the projects, the concern employed a professional design group to come in and help them orchestrate the process. In the 3rd project, they took the IDEO toolkit that was mentioned here and talked to a lot of designers and came up with their own design process. In the 4th instance, there was a workshop that oriented the engineers and the people in the Ministry of Health and the hospital in Nairobi to the concepts of design and the fundamental principles. And then they said, if this is helpful to you, we'd like to see if you can apply it there. And then they just let them run with it. So there were lots of different ways that design was introduced, and partly because there were resource constraints, and partly because I think they wanted to see if, what kind of influence design could have in different settings. So I'm going to talk about one of the case studies quite a bit today. The next slide, please. Just to describe to you a little bit about how design was applied. So this is the intervention that Lauren was talking about, where we were focusing on community health workers, community health nurses in Ghana, and trying to find ways to improve health worker motivation and job satisfaction. So a professional designer from Think Place Foundation, which is actually an Australian-based firm that's now working in Kenya and in Africa more frequently, she came and she spent, over the course of the kind of 18-month period of the pilot, she focused about 5 months of the time on a design process. So you can see most of the time, the big squiggle that Lauren was talking about is here. A lot of the designing and thinking through with end users and thinking and iterating on the design things happens at the very beginning. And this is something that's different than what we're used to. I mean, as you said, we're usually handed an RFP that says, here's the problem, here's the solution, now just prove to us you can possibly implement the solution. In a real design process, designers say, you don't even get to define the problem. You go and you define the problem with the end users, you design the solution with the end users, and only then do you say, okay, let's see if we can get some money and take it to scale. So unfortunately, Lydia, who was working with us on this, said, we already knew we had to have a mobile app because the Gates Foundation wanted a mobile app. So we were stuck with that concept. But we needed to find out from the nurse's perspective, what was demotivating? What were the pain points? What was frustrating them in the work that they were doing? So they did design research, they went to the field, they interviewed, they worked with people, they took the ideas back, they came up with some concepts. They brought those concepts back to the nurses, and they helped to reflect on them and iterate them. And that took a 3 to 4 month period before they got to the point where they were ready to start building their application. Next slide, please. So this is kind of a blown up version of this design process, so this kind of 4 to 5 month period. And you'll often see this when you do design, that people talk about the double diamond process. You'll usually see two diamonds side by side in a row. And it shows this process of trying to create that desirability lens from the very beginning. So you start with processes that bring in information and create diverging, you diverge in ideas. You leave that feasibility and that viability lens in the back of the room, in the back of your mind. You forget about the fact that you've done 25 public health programs before, and you know community health nurses really well, and you know what they like and what they don't like. You throw all of that out the window, and you use the information that you're getting and the interaction you're getting with these end users to just diverge in ideas. And it's about being creative and not closing any doors. And you get to the point where you've created lots of good innovations, and helping you think through things, and then at that point you start questioning and saying, well, what's going to work? What isn't going to work? What's our budget? How much time do we have? And you start converging again into 3 or 4 or 5 big ideas. And at that point, you would go into a prototyping stage. So you actually, it's a real luxury. I mean, I've never had this opportunity, except when I worked for Save the Children UK a long time ago, to really sit with people and work on program design side by side before we even put a lot of money into it, right? And this technique was really, really valuable, not just for getting the design of the software right, but also in the thought processes of the people that worked in the program. Bless you. Okay. So the whole idea of this whole design process, you can see the kind of words that were used when we interviewed people to say, well, how did you experience this design process from a program manager standpoint or from a designer standpoint? People said it was intensive, it was totally exhausting, it was really different, heart-changing. I knew the names of all the nurses we talked to. I could hear their voices when I was sitting down and thinking about program design. So that empathy issue was just brought right into the heart of what people were doing. And it came out very strongly in all of the interviews that we did of people that had an intensive experience in the design process. Next slide. So some of the tools that were used by the designer was to develop user personas, and that was trying to understand the collection of different community health nurses that they had heard from and put them into some categories so you could understand some of the issues that were motivating them and dealing with their job satisfaction. It's hard to see the quadrants here, but we have dispirited on one side and resilient on the other, and here we have purpose-driven and paycheck-driven. So they found this kind of matrix of 4 corners, and they tried to see if the majority of people they had spoken to were there. And it gave them a sense of the fact that they had to design something that could address all the different personas. It wasn't just designing for one kind of community health nurse, because their experiences were very different. And the next slide actually shows a journey map, which is another tool that designers use, where they sat with the nurses and they asked them to create visually, and there's a lot of visual creation, a map of their journey from the time they get up in the morning, they decide where they're going to go, how they put their schedule together, how they contact their clients, how they deal with their supervisors, how they carry their bags, every step along the way. What transport are they using? What happens when they meet the chief in the village? You know, what kind of things do they come up with? And the idea was to find out where were the frustrations, where were the pain points, what really irks you about your job, and what actually makes your job really well. So they used that as an in-depth tool to try and understand from the nurses' perspectives where they were going and how they could address some of these pain points with the mobile app. So again, unpacking that journey with your end users. Next slide. We had to take all of this information and our constructs and see if we could actually develop a pathway. So from our 4 experiences, we developed this kind of theoretical, grounded theory, if you like, pathway of how design works. And we've put it out there in the 4 case studies that we've done as a way of just saying this seemed to play out in 2, or maybe I would say 2.5 of our case studies. It didn't play out in all of our case studies, but this is what we've learned about how design really worked in that setting. This idea of that empathy between the designer and the end user, leading to a program design, creating better fit, and leading to better uptake. And in several cases, that kind of construct was something that was very notable across the cases of this empathy, better fit, leading to uptake. Next slide. So this is just a statement, I'll let you read it, from one of the people that worked on the project. He actually was a software designer that had come from Microsoft and had done training in user experience, which is what software designers are trained to do to try and create software that people are going to use and buy. And he said to us in the interviews, he said, I'm trained in this stuff, but after I did the design work, he said, I walked away with a far greater understanding of the end user than I ever had from a more standardized technology process. And he was the one that said, I can hear the voices of the nurses in my head when I'm sitting there trying to design the software, because, next slide, what they said was, they said things like, I want to be respected. I don't have enough respect in the community. My supervisor doesn't respect me. I need to be connected to my peers. I'm out in the middle of nowhere, I see a baby, I don't know what that rash is, I need to find somebody to help me with that. And they developed all of these different mobile application modules based on the kind of requests from the nurses, the way they actually expressed their pain points. And they translated the ideas from that into these 6 big ideas that they wanted to address: learning, producing good care, knowing how I'm doing, connecting with others, and turned it into this mobile application. And I don't want to go into a lot of detail, but this was just a great illustration of how the empathy that was developed in the design created a fit between the end users and the final product that was built. And the nurses themselves, there was very strong adherence and uptake and use of this. Not all the modules had the same amount of uptake as others, so they actually were able to collect metadata and understand which of the modules were more appreciated and more desirable to the nurses. And the government is actually thinking about taking it to a second iteration to say, you know, what have we learned in this phase, and how can we make the CHN on-the-go application work better. So this is the kind of pathway that you're trying to get with design, to get that better fit and to get people to take up these new behaviors and new products. Next slide, please. One of the questions we didn't ask and that came out of the research without us even thinking is how much the design process influenced directly the behavior and the approach of the program managers. Many of them hadn't been involved in a design process before, but when we interviewed them at the end and said, well, where did design come in? How do you think it affected the project? Many of them said, we didn't stop at that line, you know, that bar where we said design happened and then the project started. They said we never really stopped because we saw the value of going back to our end users on a periodic basis and saying, how's it going? Is it working for you? If it's not working, what should we do? And they said, and all of them said, we've never gone back to our end user in the same way. We've always done monitoring. We've taken data from people. But we actually use these processes to sit down and hear from people in their own words what their experience has been. And we were committed to taking that and iterating on the product as we went on. And this kind of commitment to the iteration of design and user reflection was something that I think was you know, maybe it seems obvious to us now, but it wasn't something that we thought was going to come out of the design process. We were thinking of it as more of a mechanical thing. You do design, human-centered design, you get a better design and you get a better outcome. So it really affected the lens and the behavior of the people that were in the project and that experienced the design process themselves. Last slide, I think. Yes. So in reflecting briefly on our 4 cases, we really felt that where design fits is when you're trying to introduce something new, a new idea, a product, a behavior. And that it is through the empathy and the iteration key, it gets you closer and closer to that fit so that the desirability is there and the uptake is not a huge hurdle to overcome, right? To be fair, we didn't do an evaluation. We didn't have a counterfactual. We didn't say, you know, design in this setting, don't design in this setting, let's see which works. And we would very much like to do that going forward, is have something that is more constructive, like an impact evaluation, where you can tease out whether design has actually been more effective in improving uptake in the setting. But right now, you know, we were just kind of unpacking the pathway and trying to understand its influence more effectively. So that's kind of where we are now. We've got these case studies that are just being published. We're doing a cross-case analysis that's going to become, we hope, you know, a journal article that we can publish. We're also engaging with groups like the School for Visual Arts in New York, which has introduced a new Master's in Fine Arts called Design for Social Innovation, and they're drawing on social sector implementers, architects, graphic designers from all over the world and trying to bring them together and using design for social impact programs. So we're having to do a monitoring and evaluation module for that master's course. And we're actually thinking about developing a community of practice, you know, at least in the DC area, of groups that are trying to get more interest and experience in design and to share their experience, because it's popping up all over the place. You can see some of the funders are interested in it. There's still a huge element of skepticism and not a lot of data on what is it and does it work, right? So we see that as an opportunity for all of us to collaborate and think more about, is this really a tool we want to incorporate, when to use it, how to use it most effectively. So help join us. Try it out. Yeah.
So we started a bit late, but we have a little bit of time. I think we've got about a good 10 minutes. If people have questions and comments here on the phone, maybe we should, I don't know if we still have somebody on the phone or... So any questions, any comments for our speakers?
I have a question. When you guys go through the design process, do you guys consider to what degree you think you'll be able to apply the learning that you do during the design phase? Because in our programs, often the donors talk about us scaling what we learn, and I'm wondering, how do you decide what you come up with in the design phase, how far that will apply? Like, will it apply to all the nurses in that hospital, or a district, or even a province, or how do you determine when that learning is no longer valid and you have to repeat the process?
Yeah, I think that's a really good question, and I don't have a perfect answer to it. I think what design does is start you small, so that you're designing and you're thinking and you're prototyping on a small scale, so that when you leap to a bigger scale, whatever that might be, you're not leaping blindly, right? So it gives you more evidence to say, we've tried 5 things, these 3 things didn't work, these 2 things are really working, we're honing. Now they're ready to see if they can take off in a big scale. And I think that process can be repeated going forward, even if you're continuing to iterate on the same design, or maybe you're saying, well, it worked really well in this region of Ghana, let's see if it could work somewhere else. And you would probably have to think about how different the conditions are and how similar they are, just like when you want to replicate or scale something. And obviously you'd like to avoid redoing the whole design process everywhere, because there is some universality of community health nurses in Ghana. But I think you would take that and prototype and iterate in a new setting, and then take it to scale at the same time.
I would echo that. I think there are a number of design techniques that you can use, and a lot of times people will say like, oh, well, you did this design or this user testing thing with 5 people, 10 people, really small group. And they're like, how can that possibly be representative of every community health nurse in Ghana? And the answer is it's not perfectly representative, but a lot of times the experiences are shared. So you can sort of use that as your base, as your framework for justifying changes. But you can also use design techniques where you show someone something that exists and get them to sort of respond to whether, does this actually fit my situation? Or this is the same, but this is not the same, right? And so that allows you to sort of not have to go all the way back to square one, but you can say like, okay, we've got this app. Do you feel like you are, like, is respect an issue for you? Yes, no. Is like connecting with other community health nurses an issue for you? Yes, no. Is this missing anything that really is pertinent to your life? What is this journey, does this journey map miss anything that is specific to your day that, maybe we're not accounting for? So I think there are a lot of ways that you can, the design process is meant to be iterative. That's why the squiggle sort of keeps iterating. So we create something for one district, and when we go to scale it up somewhere else, we can certainly take that and apply it again, test it with a whole new group of users, see how they think about it.
I think that commitment to iteration is what's really important, is that kind of, and we've seen it in the kind of emphasis on adaptive management, of taking data and learning and trying to cycle it through. So not just saying, we've got a program, let's let it play out for 5 years and we'll see how it worked in the end, but really trying to take stock, to stop and say, we have some data that's some of it's objective, some of it's subjective, and some of it's experiential. Let's bring it together and see, do we think this is working on a program level, right? It doesn't even have to be so specific on a product level. To me, it feeds nicely into what we've been committed to in public health, which is more user-centered participatory work, but also this idea of increased learning while doing, right? And you can see coming out of USAID and a lot of other funders, much more tolerance for, not having the perfect answer at the very beginning, saying, we have a good idea of what the problem is, we are helping to find the solution, we're partway through, and now we've learned this, and that solution might have to shift to the right or to the left to be more effective. and getting that, that idea that development is not a science, it's actually a really hard, complex learning process, and that the more we're open to learning and iteration and reflecting with end users, the better our outcomes are going to be.
I think I would agree with that, that the last 8-9 years, there's been, if you think about USAID, there's been a small group of people that has kind of built its basis and tried to scale up within the organization some ways of thinking, and now it's turning into recommendations that everybody has to abide by, whether it's on paper or intentionally, but kind of realizing that, the same thing we were talking about last time, you need to be more adaptive in your management. And if you think about it, the kind of work we do, if you have a successful community health program, if it's successful, if it's likely to have impact, the community you're in is not the same that you started with 2 years before. It simply is not. So it's not a matter of continuing the same thing, because you have changed your environment by changing the outcomes of the population. And the same could be said for health systems. So, and I was thinking about some of your comments about, why are we interested, in the impact. But can you think of a smartphone company that wouldn't want to be involved in design? What would that look like? You'd be trying to sell the BlackBerry again? We laugh, but
Yeah.
it's a little bit, we're so enamored with what works. And what works on such an absolute thing. And, and it's often what has worked at this time and on this scale and in these conditions. And now how do we need to change it? And you need to go, to me, I'd be curious, you're creative, but I'd be curious to see how you would come up with an impact design for design. Would you say come up with an app, but don't, it's kind of,
Well, maybe you would be, replicating a model that has been successful already, and you started in a community and just replicate it as is, or you started in another community and you replicate it and adapt it, make it very human-centered with the community there. You add design to it. I'm just thinking out
or
loud.
you'd compare different dosage of to take your, what did you call it?
The divergent.
The divergent, which is a bit like
The
explore,
double bind,
exploit. In complex adaptive system, you explore and then you exploit and then on again. So you could be comparing different dosage of that. Like how much stakeholder engagement do you need to have? How much prototyping? How much testing? How many do you need? Just 1 cycle or 2 cycles? So it might be.
And it's impossible to hold everything else constant, right?
Yeah, no.
That's the whole thing. It's impossible. And we all know that some programs will work well because they're just well managed, right? And people get it and they're committed. Even if they don't have design, they're good managers. And maybe, good managers are people that are good at listening to their end users. So there is this element of, there isn't a good way or a bad way. There's lots of good ways of implementing, and design will never be the magic bullet. Nothing is the magic bullet. But I think in the beginning, it gives you, better confidence about what you're trying, the people you're working with, and this idea that this has some traction already, right? This idea has some traction already. I think it's different than formative research that I've done in the past, where I've done focus groups and I've taken the data away and I said, okay, I guess we get it. We talked to 5 different groups and now we'll just design a program around it. It really forces you to take that and go back to that with that information and test it and retest it and retest it. Don't assume you get it in the first instance. So it makes you, I think, a more honest researcher and programmer in some ways.
Last comment, last question. Connecticut, phone, going once, going twice.
Will the PowerPoint be available somewhere?
Sure. Yeah, we can share it.
Sure.
For sure. You promised not to steal our little pictures.
We'll
We
steal,
love our pictures.
we'll steal everything. I steal everything from him.
You guys are, if you have thoughts, come back to us, because we're really interested in trying to use design in different settings, right? We're not going to get knowledge through unless we do it through practice. And sometimes we have opportunities to use design in JSI. You've got programs. You probably have a lot more flexibility than we do because you have your own resources to be able to do programming. So if you're interested in collaborating, we are keen, because it's not a done deal for me. I like it, but jury's still out for me.
Yeah, and you need to apply it to different things.
Yes.
So, I mean, our first brown bag was about the social milieu in which innovation happens. And part of it was, you know, tackling problems, bringing different people with different expertise and seeing how they fit and everything. So I think to be at a totally meta level, maybe getting, you know, benefits of our smart colleagues from JSI come talk to us about how they worked with Concern and others. And I think, you know, it'd be fun to see some things emerge out of this dialogue. I'm very grateful that you guys trek all the way from Roslyn all the way here.
In that Uber.
In that Uber. So you know, I mean, I think we're tackling similar things from different angles, and yeah, let's find something.
What's
to
also
progress.
exciting is thinking about taking these techniques and integrating them into managers in the field, right? What if the district health management team had a design tool or a design lens when they were trying to introduce new ways of, you know, of child health or something like that? I mean, these aren't, it doesn't have to be all rote planning. There's lots of different ways to put creativity and innovation into the processes that are already there. It's even probably more powerful in that sense when you put it into the field than if you fly us all in to execute design.
Exactly. All right. Well, thank you very much. Thank you, Anne. Thank you, Lauren.